was once told that a good talk had levity, brevity, and repetition. Let me repeat that. There's a lack of transparency about cost and quality. It's nearly impossible to understand what an episode of care will cost, nor how to compare quality between providers. The quality defects, as we've discussed, the rising rates of chronic disease. As the baby boomers age, we're going to see more and more chronic disease in this country. The lack of attention to preventive care, education and prevention. I know I'm speaking to the choir there. And finally, the structure and supply of providers in the United States. 2/3 of physicians in the United States are specialists. If you look at any other industrialized country that has half the costs that we have, it's the exact opposite. 2/3 of the physicians are primary care physicians. So, no matter how you slice it, from a perspective of safety, quality, costs, or patient experience, the current system is just not sustainable. We need to get to a new normal, a new health system that's based on an improved care model it's better integrated, better coordinated, that focuses on improving the value of healthcare and improving the patient experience. Well, to do this, we must really focus on value. We have to focus in on reducing the costs of care. We have to remove waste, and we have to remove unnecessary treatments that I talked about. We have to improve efficiency through redesigning the care model. And we have to focus this redesign on outcomes that are important. Outcomes that are important to patients, and also to lower costs for patients that we look at across episodes of care and across an entire population. This is so-called population health management, and you probably have started to hear that term. In 2012, in the New England Journal of Medicine, Dr. Michael Barry and Susan Edgman-Levitan introduced the concept of asking, what matters to you, instead of asking, what's the matter? They did this in the context of implementing shared decision-making. Their ambition was to increase clinicians' awareness of important issues in their patients' lives that could help drive customized care. Moving to what matters to you is a very simple but very profound concept that is really key to creating personal engagements with patients, a deeper understanding of what really matters to them, and it's a foundation of developing genuine partnerships. Let me tell you a story at our institution. An elderly man named Charles had been admitted 4 times in the past 3 or 4 months with poor glycemic control. Came into the hospital, and each time he was discharged, he was told, Charles, please take your insulin and monitor your blood sugar. And then he was asked, could he repeat back that education? And of course, Charles could repeat back that he needed to take his insulin and monitor his blood sugar. Well, when he returned to an office visit after the 4th admission, a nurse case manager, more skilled in shared decision-making, asked Charles, what matters to you? Instead of the usual focus just on his blood sugars. Well, Charles reported that what really mattered to him is that he needed a refrigerator. And he hadn't had one in 6 months. In fact, because he was told insulin needed to be refrigerated, he didn't even fill his prescriptions. This was really important information and allowed the team to think very differently on what to do to get support for him as well as medications in a refrigerator. Well, this is all part of the changing healthcare context. To be more patient-centered, we used to do 2 patients, right? In the past, we would just write a prescription. Some have moved to this idea of doing 4 patients. We'll make that appointment for you. And it's a step in the right direction. But we need to get to do with patients, encouraging our patients in shared decision-making and shared responsibility for taking on self-care and new levels of patient engagement. This idea of doing with and asking our patients what matters to you is really the future of patient-centered. Finally, we're moving from just a care system to starting to worry about costs of care. And with accountable care organizations and bundled payments, we're starting to bring in costs. But ultimately, to get to a real shift in improvement we need to worry about how we measure and improve the health and affordability of that health for an entire population. Economists often speak in terms of curves, these models of performance. So providers need to get to this new curve. This really involves us in shifting our thinking. From the old curve being volume-based, we talked about getting to value-based. Moving away from fee-for-service to population health. Moving from just being a hospital-based system to truly being a true delivery system. Moving from a system where quality is not rewarded to a system where quality is measured and rewarded. And from just being a sick care system to really go towards proactive and preventive care.